Hey guys, this is Dr. Hub. Today we are going to look at the classification, and this is going to be of the local anesthetic, and it's based on the chemical structure. So based on the chemical structure. So to begin with, the chemical structure, it is divided into two, that is the amino ester, as well as there is another one, that is the amino amide. Now let's get started. So we look at the amino ester. So the amino ester, looking at the stability of it, it is relatively unstable in solution. It is unstable in solution. And what about the metabolism? Looking at the metabolism, it is the plasma cholinesterase, and the exception is that there is cocaine, which is predominantly it is by the hepatic carboxyesterase. Hepatic carboxyesterase. Now we look at the duration of action. The DOA, the duration of action, it is shorter acting. As well as there is an exception. The exception here is that it is tetracaine is the exception. So this can also have an allergic reaction. So what is the allergic reaction? So there is an allergic reaction, that is high incidence due to metabolic PLAB. Due to the metabolic PLAB. So what are the examples of the amino ester? The examples, it includes, there is procaine, there is also the chlorprocaine. Next is there is presence of cocaine, benzocaine, as well as there is tetracaine. So this was about the amino ester. Next we are moving on to the amino amide. So it is AA, that is amino amide. So this amino amide, the stability, if you look, it is more stable. It is more stable due to the presence of methoxy group. So amino amide has a methoxy group, which gives it stability. And looking at the metabolism, it has the hepatic metabolism, and that is the amidase. There is an exception here in case of the amino amide. So the exception is that there is a articaine plasma cholinesterase. There is articaine plasma cholinesterase. Now we look at the DOA, that is the duration of action. It includes, there is longer acting, as well as there is an exception. So the exception is articaine, whereas in case of amino ester, the exception was the tetracaine, and here the exception for longer acting is articaine. So in terms of allergic reaction, it is rare. Next we'll move on to the examples. So under examples, there is lidocaine, mepivacaine. Next there is also the prilocaine, bupivacaine. Then there is also the ropivacaine, etidocaine. Then comes the diducaine as well as the articaine. So all these are examples of the amino amide. So now in this video we have seen the classification of the local anesthetics based on the chemical structure. We saw there is aminoamide and the amino ester, and we compared the characteristics between them. To learn and grow daily like this, please do subscribe.